Hello, I'm John Kanellopoulos, and on behalf of our research team, Flavia Zani and George S. Mellis, and the Laser Vision Clinical and Research Institute in Athens, Greece, I'm pleased to present to you the femtosecond laser flap parameter manipulation in order to reduce opaque bubble layer incidence in myopic and hyperopic LASIK, along with our novel proprietary digital analysis technique. We'll introduce the file report from the FS200 in a particular case. We'll adjust the flap borders as you can see here, and automatically on the top of your screen you can see how this corresponds with the actual digitized dimensions of the flap. We'll use another example here. Here we have a little bit more OBL, and this will be expressed in percentage of the total flap area, the exact amount of OBL, expressed here as a percentage. Femtosecond LASIK has been greatly popularized, but one of the intrinsic mechanisms of this procedure is the generation of gas and the possibility for it to induce OBL that may reduce the ability of the patient to focus during the procedure, or tracking systems to correct for centration and potential cyclorotation. Other clinicians have also suspected that OBL may also change the way the laser ablates the cornea. So considering these factors, we're analyzing here in very objective way to measure the OBL occurrence in LASIK cases and how manipulating the femtosecond laser parameters reduced the OBL occurrence. So in methods, we studied a total of 72 patients, 36 patients with the newer technique, Group A, in which 72 eyes, both eyes were treated in all the patients included, had a wide canal constructed with the FS200 laser, specifically 1.7 millimeters in width, and canal line separation of 2.5 microns between the two spots. This canal is the venting channel that you can see on the right side of this slide. Other statistics are that the Group B we included matched in regard to whether they were myopic or hyperopic in the amount of diopters corrected, sex, age, with the Group A, and in which we had used our older previous canal design parameters, meaning 1.3 millimeter in width of the canal and 7 microns as a spot separation in the canal line construction. All procedures were performed by the same surgeons and the same femto and excimer laser were used. The results are quite significant in the benefit that occurs with the newer canal parameters, meaning the OBL incidence, which was almost half, 3.69% of the flap area had OBL in Group A, and 6.06% with a much higher standard deviation, meaning more cases with OBL, which is significant, over 10% in the older Group A. And you can see the OBL area to flap area ratio for Group A on the top right, and the comparison of the two group parameters on the bottom right. And again, we're talking here about very small amounts of OBL. The largest one encountered in Group A was 11% of the total flap surface area, which would be clinically not that significant, and there were a very large number of flaps in Group A with no OBL at all, not even a 1% OBL occurrence. And you can see in Table 1 the incidence of opaque bubble layer expressed as a percentage of total flap area, with comparative results for the wide and narrow canal groups, and the statistical differences here. And in Table 2, the comparative OBL histogram data expressed as a percent or fraction of the total flap area for the two groups. And on the far right bottom corner, the actual histogram showing more illustratively the difference between the data of these two groups evaluated. So in conclusion, in our study, the extent of overall OBL occurrence with this femtosecond laser is generally very small, but it appears that the new parameters for flap canal creations have really benefited the outcome, which was a reduction in OBL formation, and was statistically significant. And along with these data, we're also introducing a very novel, potentially a benchmark of digitized objective methodology for LASIK flap parameter calculation and OBL extent assessment. And these data and the methodology has been subsequently submitted and published in the peer-reviewed literature. Thanks very much.